Hello. Thanks so much for coming. My name is Katie, and I am a classmate of David's, and we are both, fingers crossed, graduating in May. And I am so pleased as a fellow classmate, as a colleague, and as a member of the student government that David came to us and asked to put on this panel, because I think that we have such a rare opportunity to hear directly from people who identify as living with a diagnosis of autism and NVLD, and for them to be so open to be here and to answer any questions. And I just wanted to sort of put my own little personal, because I just can't resist, that I think it's very important to think about all of our experiences in terms of living in our society with people who also have a diagnosis of something. Because I think a lot of times in school, diagnoses are discussed as something that another person has, and you are in a position to assist. And I think that misses a huge opportunity of really seeing the world as we all have our own strengths and our own challenges. And someone who has been diagnosed as on the spectrum is just another person who has strengths and challenges. And we all have to learn how to navigate those strengths and challenges for ourselves and for others. So I really thank you guys so much for coming here. So I'm going to let them introduce themselves, and they're going to talk a little bit about their own experiences, and then we're going to open it up to questions. Thanks.
All right. So thanks everybody who's here tonight to hear our stories and our perspectives on ASD and NVLD. This is Navigating the Sea of Masks, Experiential Perspectives on Autism Spectrum Disorder and Nonverbal Learning Disorder. I also want to thank all the people who contributed to getting this event up and running. Caleb Demers, Frank Brooks, Katie Finch, Dave Daddiego, Chris Hall, Ray Handy, and Sue Ann Johnson. Thank you very much for your support in getting this up and running. I also want to mention we did have a fourth speaker planned, but unfortunately a family thing came up and she was not able to make it for tonight. So I am David Koenig. I'm a student in the MSW program here at UNE. This is my final semester. I was diagnosed with Asperger's and nonverbal learning disorder when I was about 12. Asperger's is now part of the autism spectrum disorder diagnosis. I live in Portsmouth, New Hampshire. And now I'm gonna pass the mic on to my good friend, Chris.
Hi, I'm Chris Suosso. I'm from Manchester, New Hampshire. I'm a student at Southern New Hampshire University. I'm a history major. I'm be graduating in a couple of weeks with a bachelor's. I'm 26, and I was diagnosed when I was 17 years old. I'll pass it on to Kelly.
Hello, my name is Kellie Sikorski. I am 28 years old, and I am from Hampton, New Hampshire. When I was younger, I was diagnosed with nonverbal learning disability and pervasive developmental disorder, non-otherwise specified, which are now under the new umbrella term, the new umbrella term is autism spectrum disorder. I just wanted to mention why I'm here. I'm here to help inspire, explain, and help others learn and understand about autism and what it's like living with it. and I'm going to give some brief descriptions, the definitions of each each type of autism that we'll be talking about this evening. The first one is autism spectrum disorder, or ASD. Autism spectrum disorder is a name for a range of similar conditions, including Asperger's syndrome, that affect a person's social interaction, communication, interests, and behavior. Pervasive developmental disorder, like I mentioned earlier, non-otherwise specified. Pervasive developmental disorder, non-otherwise specified, is applied to children or adults who are on the autism spectrum but do not fully meet the criteria for another ASD, such as autistic disorder, sometimes called classic autism, or Asperger's syndrome. And then we have nonverbal learning disability, also known as NVLD. Nonverbal learning disorder is a learning disorder characterized by verbal strengths as well as visual, spatial, motor, and social skill difficulties. Okay, how I became diagnosed. At an early age, I started showing signs of being off. I didn't walk, but scooted around the floor on my butt. It was quite funny, but it was quite funny when I look back at videos. I was a late bloomer, so to speak, since I didn't start walking till I was 18 months old. I was at my cousin's christening party, and all the young kids and I were running around like crazy kids. Two of my aunts, sisters, who are both physical therapists, put their hand out and said, "Stop." All the other kids stopped, but I stopped and sat down, and I didn't move. It was an unusual sensory response. After that, they went to my mom and said that I needed to get tested. As a child, I had behavioral issues. I didn't like my routines changed. I had repetitive habits like rocking back and forth. I have sensory issues. I'm sensitive to certain stimuli. For me, mainly it's touch, tactile, and sound. I used to hate washing my hands. I used to hate brushing my teeth. My shirt sleeves had to be held, like I would hold them and then pull my sleeves through, which I still do to this day. The worst The worst sounds to me as a child were fireworks and fire alarms. My parents would take me to fireworks and I would scream my head off. And fire alarms, they were just too loud. It was in third grade when my occupational therapist, who mentioned the term nonverbal learning disability, that diagnosis had never been mentioned. My original diagnosis was other learning disability. It was then that my IEP added support for my nonverbal learning issues. Other issues that tend to come with autism spectrum disorder, for me personally, I have dyspraxia. It's a developmental coordination disorder. It affects physical coordination. So when I would wake up in the morning, I would have trouble moving and using my hands. So my mom would use a brush, soft brush, she would try to stimulate my nerves to work. I have anxiety. What I have is called panic disorder, which can cause me regular sudden attacks of panic and fear out of nowhere. I think one of the biggest issues for people with disabilities like ours is that it is not visible. People treat us differently, sometimes mean, because they don't understand our issues. I remember thinking I would be better off like my cousin Nicole, who has cerebral palsy because she was in a wheelchair, people felt bad for her and were always nice to her. They could see her disability. Both as a child and now, like other children with nonverbal learning disability, I tend to talk a lot. When I was younger, I didn't always share my thoughts and feelings in socially appropriate ways. My parents would ask me, you know, how was your day? And I would say fine, and then I'd go into the other room and talk about everything from my day, from the morning I woke up to the time I went to bed. I don't know why. I also tend to not relay the most important information, especially when I had to do readings for homeworks, and then answer the questions based on the specific information. I have trouble understanding communication that is not verbal. And for some, it is body language and facial expressions and tone of voice. For me, it's mostly your voice. It's not what you say, it's how you say it. So when my friends would make a sarcastic comment or would tease me in a teasing manner that was meant to be a joke, I would snap at them, not realizing that they were just joking. And then they would look at me like, what did I do wrong? And I didn't know how to respond to them. I struggle with accuracy and speed, whether working on homework or in a job setting. Some children with nonverbal learning have good language skills, but I have trouble sorting through information and understanding the bigger concepts behind them. I struggle with math, reading comprehension, especially word problems, and coordination. I think in literal terms, and I often miss subtle nonverbal cues. I have overcome a lot of the challenges that come with my disability and what a lot of people who have the same disabilities as me, what it affects. When I was younger, they told me that I would never ride a bike, I'd never drive a car, or climb a tree, but I have done all of them and still do them today. I have 2 jobs, both working with animals and people, though most of the time I prefer working with the animals. Technology has been a big help, as I cannot always understand directions, so thank God for GPS. And I was able to travel to Lowell, Boston, and Everett, Mass. for filming. I have been in 3 movies as an extra, and I was able to travel to these 3 places, which are very far from Hampton. I am very proud of this accomplishment, and this shows the variability of degrees of disability with a person with nonverbal learning, PDD, NOS, whatever type of autism they have or disability. It just goes to show that they can have, as long as they have, they can be successful, as long as they have support, whether it's from people like us who have experience, or people like their parents, family members, social workers, anybody, that they can be better and successful in their life. I don't know. That's really all I have. I don't know. Did that go too long?
So I knew Kelly would have some stuff planned out, and I knew David would probably be technical. So I figured I'd be a little bit more off the cuff. Also, this is just a good excuse to not have to write anything down. So I thought I'd be a little more topical since we're at a university. I thought I'd explain an autistic's experience of school. So when I was younger, I guess I'd like to call myself a chameleon in that I blended in so well with normal people that I wasn't diagnosed until I was about 17. So that was a long time to go undiagnosed, though my mother always knew that something was off, but she wasn't a very educated woman in terms of those things. So she could have told the doctors over and over that something was wrong. Well, maybe not wrong, but something was off. And they said, he's just shy. It's a phase. He'll grow out of it. And as I grew older, I seemed to get better, but that was just sort of coping mechanisms, shielding my actual problems. But when I was younger, I was held back a few times. First, it was sort of preschool. I went a little longer than most kids would have. And then after kindergarten, I was held back as well. It's easy in hindsight now to see that that was really just my lack of social skills. They just thought, oh, he's maybe a little incompetent or he needs time to develop intellectually, but that was not the problem at all. So in school, I did well in terms of testing, reading ability. It was in situations where I would have to work in groups or sort of a class-wide thing where you'd have to speak up, and I knew that in those instances, social anxiety, just my ability to not deal with people. So I always found ways of getting to the end point, but so as more of an analogy, whereas everybody sort of went over the mountain, I had to tunnel under it, and I got there at the same time, but no one else noticed that I wasn't behind them the whole time. So there was always creative and clever ways to get over things. If I had known back then that that was really just putting off the inevitable and sort of keeping me back and not allowing me to be diagnosed, I wouldn't have done such things. But just being a clever little boy, I couldn't help myself. So middle school wasn't much better. So when you're in your preteens and teens, socializing becomes paramount, and obviously I was incapable, or perhaps not incapable, but I would say that that's sort of when my antisocial aspects of the ASD started popping up, and I became very disliked by most people. I guess dealing with social anxiety and depression, that sort of welled up a feeling of desperation, and I sort of was projecting my own self-hatred onto other people, and as you can imagine, that didn't go so well for me. So middle school went off without too many hitches, but it wasn't very pleasant. High school was when things got really bad, and of course that's when I was diagnosed. I believe it was sophomore year, the very beginning. So my high school experience was very bad. I ended up dropping out after sophomore year for several reasons. I mean, my diagnosis and their inability to help me, or seemingly to know what to do at all, was a factor, but also intellectually they weren't meeting my standards and they weren't challenging me in any conceivable way. When you're in situations with teachers where you're correcting them more than they're correcting you, it's probably time to leave. So I left high school after a while because, well, I guess I should roll back a little bit, because part of what's difficult for kids in school, especially when you have ASD, is a lot of special ed departments just don't know how to deal with you at all, because they like to place you into little check boxes, and if you got a round hole in your square, they're going to try and fit you in there no matter what. No matter how much damage they're going to do to you, that's irrelevant to them. They just want results, by any means necessary. So at certain periods of school, they would stick me in what they call the resource room. So just about everybody there, ADHD, just various kind of minor learning disabilities. And so they looked at me as just, do you not concentrate well, or do you not sit still? And of course, none of those things were the case. So I spent most of my time tutoring the other kids, from the ones younger than me to seniors. I remember distinctly that I'm pretty sure I helped at least 2 of them graduate that year, single-handedly. So the teachers there didn't seem to have any understanding of what I needed from them. Their solutions were just make it impossible for him to get a failing grade and just push him through. At this point, a lot of just public schools are just, an assembly line, just pump kids through. It doesn't matter if they know anything. We just don't want to deal with them. And being on the spectrum, you're an unknown hassle for them. You're an unknown quantity. They can't deal with you. Either more money, more resources, more time, and they don't have any of those. Or if they do, they don't want to spend them, at least on you. So the experience was very negative, so I left. There was a 6-year period of me sort of wandering. I spent a few months in a mental hospital. That was at my lowest point. When you hit rock bottom, you need a point of exit. So I got on sort of the right medications, and I worked myself out of that. I worked some kind of dead-end jobs for a while. My last one was in 2013. I was an electrician's apprentice in Vermont. And when you're crawling around houses that are like 150 years old and possibly poisonous and dead animals everywhere, I figured, I don't want to have to do this my whole life. Not that it wasn't enjoyable in its own way, or not that it wasn't honorable in its own way, or that it didn't feel accomplishing, because it does. And I have several electricians in my family, so it's a very noble calling, I think. Often it's not rewarded enough. And it's not that the money isn't bad either, because it was very good. But sort of always being a bit of an intellectual my whole life, I said, I don't want to be crawling through ditches, for money. So I finally convinced myself to go to college. People around me had always wanted me to go because they saw my potential. But I didn't feel that it was necessary. So now that I'm graduating, my view of university is still not very much changed. They didn't challenge me at all. And I don't know if that's just me or the system, but at least in my case, I felt that they didn't kind of meet my standards. But again, that's probably just me. But school for autistics is more challenging than it would for most kids. I mean, for most kids, they don't want to be there, period. And that's no different for autistics. Honestly, it's like a prison for everyone. But for autistics, the extra challenges mount very quickly, and the stress is unbearable. And your lack of making friends or having friends and losing them constantly is a continual drain on your morale. So in my case, going through school was still positive enough that, I wouldn't necessarily suggest autistics not go to school or get homeschooled or anything like that. I think the socialization aspect is necessary. By high school, probably not so much. They could probably just do away with that. At this point, it's just a social experiment anyway. Especially with higher functioning autistics, we tend to be intellectual to a degree, and we expect more out of classes, and we want to be challenged constantly, but schools often don't meet that challenge, and at this point I don't know what else can be done. But I'm not necessarily a problem solver, so I don't pretend to be. Well, I guess that's about all I have.
That's all you got? All right, could you hold on to that for just a sec? I'm going to put that on this one. Can you hold on to me for just a sec?
Yeah. I'm just going to hold on a little bit. He has something to get. Oh, he's going to get theatrical.
I was going to say, I thought you were going to wear it the whole time.
Well, I didn't want to steal the show.
I'm very appreciative, David.
This is what socializing is like.
So, one thing I wanted to mention that I feel is really important about autism spectrum disorder and nonverbal learning disorder is that most of the people who talk about it, most of the people who research them, they're not people who live with it. And that's kind of the main reason I was interested in doing this event, was to get more people speaking from the inside, so to speak. But at the same time, there are people that we can't speak for as wholly. So none of us here have autism spectrum disorder with intellectual disability. All of us here were able to speak verbally, and so we can't relate to those experiences the way that people who have those combinations of challenges can, but we can talk about the things that we have in common. There are also other traits that people have that we might not be able to speak to with how they interact with ASD. One example would be, none of us up here on the stage are people of color. There's not a lot of information on how race intersects with autism spectrum disorder or nonverbal learning disorder. And I just wanted to point out that although I'm really glad that we're able to speak as people from the inside, we're not able to speak from the perspective of everybody who has ASD or nonverbal learning disorder. So, one of the things that I hear a lot said about people with ASD or NVLD is that they have trouble with seeing the big picture, or they're in a conversation and they go somewhere unexpected, and then that's seen as being like either defiant, like they're skipping to something else because they don't want to talk about it, or it's seen as they're just not really invested, not really paying attention. But I kind of see that a little differently. I don't really think there is just one big picture with anything. I think that people on the autism spectrum and people with nonverbal learning disorder, they tend to associate things differently than people who are neurotypical. They tend to make connections a little differently, and if you think about it in terms of those, connect the dot pictures that you can like pencil in and it'll make a picture, I think a lot of times with a lot of things, there's this picture in mind that people are expecting people to get to. Somebody with ASD or NVLD, a lot of times they'll get to that picture, but a lot of times they'll come up with something that's not quite the same or something that's completely different. And it can be really like frustrating if you come to a different conclusion and people kind of react in a way that's condescending, or they react in a way that's disappointed or angry about it. I've been an avid reader since I was very young, and I found that as a kid, and still to this day, I have trouble with figuring out the main point that most people can see, the primary message of something. And I have trouble with kind of deductively pointing out, okay, these are the major points, this is the main message that the author was getting to. I'll tend to come up with my own interpretations, and sometimes I'll come across a few different ways, and then I try to guess, okay, what's the answer that people are typically looking for? What's the interpretation that I'm expected to have? Oftentimes, I'll miss out on what is seen to a lot of people as common sense, but I'll come across my own understanding of something, and when I share that, sometimes people just react and kind of say, well, you're way off there, Dave. That is not at all what this is about. And other times they're like, oh, that's really interesting. I never would have thought of that. And I feel like there's value in this different perspective, this different way of understanding things, because if you think about it in a societal sense or a cultural sense, the more ideas that we have as a whole, the more we have to pick from, the more different combinations we can use and apply. I've done some work as a peer mentor, as a tutor, as a case manager, as a psychotherapist doing group work and individual work. And many times I've run into a situation where I'm working with somebody who's on the autism spectrum or has nonverbal learning disorder. There's another person working with them who is neurotypical, and the person that we're working with, they'll come up with something that'll be like, it seems totally out of left field for the person who is neurotypical, but then oftentimes it makes like sense to me. Oh, I can see why this person is going for that. And then being able to point that out, it's helpful for the person who's neurotypical, because they, I think, can get a better understanding of how this person is understanding things and making connections. And a lot of times the person that we're working with has a really hard time with defending themselves if they're kind of told off for going off topic or coming to the wrong conclusion on something. One of the things that's, I think, very common with both ASD and NVLD is executive functioning challenges. And nonverbal learning disorder, that's not affirmed by the DSM-5. It's not in that manual, but ASD is, and it'll talk about social communication challenges, special interests, of enjoyment of routine. It'll mention sensory integration challenges as being common. But it doesn't really mention executive functioning, and that kind of irks me because at this point I've maybe met and worked with probably about 60 people with ASD, probably a much smaller number with NVLD, maybe 5 or 10, but in this population that I have direct experience working with and talking with, I see what looks like at least one executive functioning challenge in probably 4 out of 5 people. And executive functioning, that's a collection of skills, you want to read the definition?
Well, I just had skills affected by NVLD.
Mm.
Is executive functioning such as working memory,
Mm-hmm.
organization and planning, cause and effect relationships. So like we have trouble not only Sure. So one of the things I thought, and I didn't mean to interrupt you, but one of the I thought people want to know the symptoms of the different types of the nonverbal learning and the autism spectrum disorder, and I just had one of the things, some of the skills that are affected, especially by like nonverbal learning. You have the conceptual skills, which is grasping the larger concepts, problem solving, and that includes the executive functioning, such as working memory. So like, one of the things I think of when I think of working memory, and this may not be anything to do with working memory, but like when I'm doing a task at work and my boss says you have to do it in 20 minutes when I know it's going to take me longer than 20 minutes, and she'll get aggravated at me or frustrated at me. Like even, let me rephrase that. So the manager will say, well, it takes the boss, my boss Paula, it takes her 20 minutes to clean a pen. Well, for me, it can take an hour for me to clean a pen, only because I'm trying to, I take it literally. I clean the whole entire pen until it's like spotless, which some people may do it fast, but I think if I do it fast, it's going to be half as good. Organizing and planning and cause and effect relationships. I know one thing I have trouble doing, and one of the things I have at the bottom is they have trouble understanding and organizing their thoughts and putting pieces together, whether it's a problem solving, whether you're doing a word problem, or even putting pieces together when someone's telling you a story and then they give you questions and you have to pick out certain information that's the most important, when we tend to not know which part is important. Or maybe a more easier way to explain it is when someone gave you something for homework and they say, okay, highlight the most important things. For me, that was pretty much everything I read. So I would look at it and be like, well, this looks like one of the most important pieces, and then my mom would be like, that has nothing to do with it. And I'm like, oh. So we have trouble with abstract thinking, social skills, we've mentioned that. visual and spatial skills. Some of us may be better at hearing whether we're given a task to do or we're listening in class or even a conversation. Someone, I just lost my train of thought for a minute. Sorry about that. Yeah. I'm sorry.
We're good. So another thing I like to mention about executive functioning is I feel like in the people that I've worked with and the people I've known in general, I tend to see challenges more frequently in the areas of like planning and time management than I do in emotional regulation and metacognition. As for how executive functioning applies to myself, I was a kid who had an incredibly challenging time with doing homework. In school, most subjects I did fairly well with, but with homework, I really struggled with getting started on it. And I really struggled with remembering to do it, remembering what was assigned, remembering to like pack it in my bag and bring it home, or bring it to school, or to put it in the right folder for the right subject where I could find it later. I had huge challenges in this area, and I remember, I think in one of Tom's classes in like research methods, he asked the question, like, what is a college dropout? Well, here I am, as a graduate student, but I'm also a college dropout. The first time that I attempted college, I was taking 2 classes at a community college, and I was not able to keep track of my assignments. I was not able to remember to do them, and I struggled to get started on them, and I ended up dropping out and then feeling really ashamed about it. I didn't tell most of my family because I felt like a failure in that. But when I made a second attempt at college, my time management skills had developed enough that I was able to, I feel like I could really build on them for the first time, mostly by using like a planner. Previously, I had tried to use one and I would forget to bring it with me or forget to check it and forget to write down half of the things that I was supposed to do. My second attempt at college, I was able to start building on that, and 10 years of like working on that later, I'm a lot more skilled at that, and I can keep it together pretty well most of the time. But when I was 18, when I dropped out, I didn't know if I was ever going to develop my time management skills, ever get like good enough at that to make it work. I didn't know if I was ever going to be able to make it through a semester in college with more than one class. Some of the people I've worked with in the past, they have intense challenges with time management or other areas in executive functioning. And I feel like there's not a lot of role models of success for people with ASD or NVLD in general. I didn't really have any examples of others that I could look to or talk to that I knew. But I feel like being able to tell others, you know, hey, I struggle a lot in this area, and, you know, I got a little better at it over time, and so I think maybe you can too. And people that are afraid to try something because they're going to fail, I can say, well, failure isn't the end. I failed out of college, but then I was able to find success later on, pointing out the hope after a failure, whether it's academic, whether it's time management, whether it's work or social interaction. I feel like there's still room for people with ASD and or NVLD to develop in these areas and to make improvements and to grow more independent. So I feel like I've been talking for quite a while, and I'm wondering, do we want to get started on taking some questions?
Hi. First, there's so many things that I want to say and so many questions that I want to ask, but I'm going to try and just focus on not asking too many questions, saying too many things. All right, so first of all, thank you guys for sharing your stories. I am a special education professor here at UNE. I teach in the undergrad program at Biddeford, and I teach a class on autism. I do not have autism. So when you talk about, you know, and I do research with kids with autism, so thinking about your statement about, I don't have those experiences that people with autism do. So the course is going under a major revision this summer, and I'd love to get your input, have you take a look at the syllabus, you know, if you guys are interested. I'd love, here we go again, right? I'd love for you guys to, if you want to come speak in my class. That would be amazing. I feel like so many things that you were saying, I was just like, where are my students? Why aren't my students here? Well, can I record this? It's just so impactful. And I mean, your story is a lot about education. While a little, you know, disappointing, it's not a surprise. But I want to tell you, and everybody else in the audience, there are good teachers coming out, and we are teaching them good things. So at UNE, we don't have a special ed program. I just work with general ed teachers. So there are a lot of general ed teachers that are taking a course on autism. So I'm hoping, right, that the kids who come along who aren't in that box, right, and who is in that box really, that we're preparing them to work with those kids. All right, and now I have a question. So, I know, I'm sorry, I just can't help it. You guys spend a lot of time talking about what's really difficult for you because of autism or NVLD. And I spend a lot of time in my courses talking about what the challenges. What are some ways or one way that you think autism and or NVLD has kind of benefited you and maybe you like having that part of your life?
So maybe we can each give one answer. I'll pass it down to Kellie to start us off.
That's a good question. I like the fact if you want to call it, because I never knew I was autistic when I was little. I just knew I was off, and I had anxiety, so I was nervous about everything. I like the fact when I mention something in a new way of thinking, so like whether it's at home or at school or at work, I'll mention something. I'm trying to think of a good example. Maybe, well, because I work a lot with animals, so sometimes when someone comes up to me and is like, well, my cat's not acting right, and the vet says there's nothing wrong with it, I may look at the animal or hang out with the animal and be like, well, did you think of it from the animal's? Oh, wait, that's a good example. Sorry. Let me rephrase this. So, and there I go, losing my train of thought. I think from all types of perspectives. I even did it here when, I can't remember your name, I'm sorry. Fred, and when Fred asked, Frank. Or actually also when David asked, is it too dim in here? And I said, well, if I was coming in here and I was a student and I'm gonna be taking notes, I think I'd want a little bit more light, so it might be a little too dim in here. That might be one example from another perspective why I like having autism. I don't mind it now because I know what I was when I was younger. If I had been diagnosed, if someone had told me that I had autism when I was younger and explained to me what it was, if I could explain to my younger self, it gets easier as you get older. You'll learn tactics to help you get over whether it's anxiety, whether it's social skills, a different way of thinking. I don't mind having autism. I love surprising people. Like when someone hears nonverbal learning and they're like, so you don't talk? And then they hear autism and they think of the lower type of autistic who, they don't look at you when they talk, or maybe they don't even talk at all. And it's very different to say, when you're diagnosed with autism, and it's like, okay, well, which one am I? So then when people look at you and they hear, oh, you have autism, it's like, wait, what? But you're normal. You don't look different. You don't act, well, you act different, but, things like that. Maybe I'm rambling. I guess I can go on to him. I can explain it more after.
To be perfectly honest, I don't think I'd be half the man I am if I wasn't autistic. So the various trials and tribulations of my life, I think, have hardened me to an extent, and I had to sort of grow a thicker skin than most, because I see that I can sort of weather a lot of stress that I've seen in other people that they just withered under it, and I just go through it and it's not a big deal at all. So I can deal with all sorts of abuse, and it's just not a problem because I'm like, I've seen worse. When you've reached sort of rock bottom at some point in your life, and nothing's worse than that. So, I'm always thinking it could always be worse. So, I think, in a way, like I said earlier, that I've been a bit of a chameleon in that I learned to learn coping mechanisms very early. I remember talking to someone, and I told them about sort of the things that I would do when I was younger, around 7 or 8, and they said you shouldn't have been able to do that until you were like 12 or 13. So obviously, the double-edged sword there is that it kept me from being diagnosed for far too long until I was pretty much at the exploding point. But in the intervening years of that, I learned all sorts of coping mechanisms. I had to be quick and clever in a way that most people wouldn't have to be ever. So I think in the end, I think the sum total is more positive than negative.
So one of the things that I often tell people about being on the autism spectrum, having nonverbal learning disorder, that I think, like a lot of people, don't find it very believable. But I feel like it's helped me to be a better listener and to be more understanding of others, because when I was about 12, I had an experience in school in the 6th grade. I was on this little group. We were supposed to plan a project for the school. I was really hyped up about this idea to put in a water fountain outside. And I thought that was what we were gonna do. Everybody that I talked with about it before we had our meeting was also enthusiastic, so I thought it was pretty much a done deal. But one of my classmates at that meeting was like, well, we haven't decided on this yet, and I actually don't want to do a water fountain. And that was a moment that was kind of an epiphany for me, where I realized, yeah, people don't necessarily want to do the things that I want or have the same way of looking at things. So kind of that, in combination with really struggling with reading body language and facial expressions and all of that nonverbal communication, I tried really hard from that point on to not make assumptions about what people think and about what they want and what they like and what their experiences are without asking them first. So I do feel like, yes, there's a lot of stuff that I miss that makes it harder to understand others, but I think that being on the autism spectrum led me to being much more careful about making assumptions. And I think that being on the autism spectrum, having nonverbal learning disorder, helped me to understand difference and discrimination in general. Like, I have a lot of privilege in American culture as a white man, but I also have these challenges that make me a minority in a sense, even if it's not visible. And I feel like that helped me to both understand and be open to the perspectives of people who belong to other minorities or multiple intersections of minorities.
One of the things that I don't mind about having autism is it kind of allows me to be, I'm not afraid to be who I am, and I'm not afraid, I'm kind of an open book, so, and I have no filter, as my parents will tell you. Kind of goes with the territory. But I kind of am the way I am, and I like the way I am, and when I was younger, I would have loved to take a pill and be normal, or normal, and get social skills or socialization, get the facial cues and all that stuff. But with having autism and then also having my anxiety on top of it, I had to grow up a little what not David, sorry. Whoopsie. What Chris said about he wouldn't be half the man he is today without it. I probably wouldn't be half as successful as I am today. One, because I have the support of my parents and my siblings and the people who wanted to help me through school, but also I didn't have anyone to show me who was on the autism spectrum, who knew that I was autistic, to say, you shouldn't do that. Oh, you shouldn't be this way. This is how you should do things. I had to learn it on my own. I had to learn my own techniques for not only getting over panic attacks or anything like that, but interacting with socially, school, and things like that. I had to grow up a little faster than when people, especially when they see children and they're like, you need to be more mature than you are. I know for me, I'm a little, I may look like I'm 28, but when you work with me, when you see me doing a task or doing homework, I may be more like an 18, 20-year-old. So my maturities sometimes in certain situations is different. For when I'm talking about this, I'm more mature because I had to learn, I had to do it myself. I wasn't taught it, versus someone who did or didn't. Now I'm just rambling. Sorry.
Does anyone have a question? Yeah. Oh, let me get this one in the back. Hold on.
Hi, thank you. I was wondering, in terms of social workers or counselors that you worked with, in terms of therapy or those sorts of things, what was the least helpful and the most helpful that neurotypical providers did for you or said for you?
That's a challenging one. For me, what helped me the least was, I guess sometimes it's mostly when people hear that you have a learning disability and they assume something that's not, they hear nonverbal learning and they think it's the opposite of what it is. So they're like, oh, nonverbal, oh, you don't talk. No, the opposite. What helped me the most was probably the fact that I had support from my parents. I had support from people who recognized my behavior and were like, you need to be tested so that I could, not only my parents could know what was wrong so that they could help me, but so that I could know what was wrong so that I could help myself. Just now, what helps me most is talking about it and being able to share my thoughts and feelings, versus when I was younger, I didn't know how to do that. And now I do. I guess a lot of things like that.
I remember the first psychologist I went to see. It was all right for a while, but I remember the last instance was that was having trouble, and then he just suggested that maybe I should get a girlfriend. And I said, oh, really? And I just got up and I left and never saw the guy again. Because I'm like, that's not a solution. Looking back, that probably wouldn't have been half a good, probably would have been half a good idea at least. Later experiences, I'm like, oh, maybe he was sort of onto something, but that was just like sort of my childish view of that was, I'm like, that doesn't seem clinical at all. Probably years later, I worked with a man, and he had me do practical exercises, so he would take me out, and we went to a hot dog vendor, and he had me converse with him, do the financial transaction, and just like small things like that, and he kind of like walked me through it. So I would say that had been the most useful, and just like being practical. We tend to not need anything fancy, just sort of, if anything, we need practical training, if anything.
So in my case, I worked with one person as a kid in middle school who was really insistent of like his perspective of who I was, and I felt he was way off, and we sort of had arguments over that. So that wasn't very helpful for me. I did see somebody much later who was much more helpful, and I feel like there were 3 pieces to that really helped me. He really listened to my perspective, and he empathized with what I had trouble with, and I found cognitive reframing to be very helpful. I was working with him partly in relation to depression and anxiety that I had been experiencing for many years, and that modality, CBT, that was very helpful for me.
Add one more, if I can keep my thoughts straight. Another thing that helped me, and because I didn't really know I was autistic until I was out of high school and even after college, one of the things I felt helped me was I read up on, what is ASD, what is nonverbal learning, what is pervasive developmental NOS, and for some people, especially like hypochondriacs, they may read something and think, oh, I have that, and it may make it worse, or they may get down on themselves about it. But for me, it was the opposite. I read it, and when I read the symptoms, I was like, that's me. And when you're younger and you're growing up with autism, you don't know why you're off, you don't know why people treat you the way they do. And then you find out you have, whether it's autism, whether it's a learning disability, whatever it is, it's like a weight gets lifted off your shoulders. And for me, that's kind of what it was like when I found out what it was.
Thank you. You have a question?
Yeah, I'd like to ask you, David, more about your mask and what that signifies for you and when you take it off.
So I was waiting on this question, and I would like to ask you, would you like me to just kind of talk about it, or would you prefer a poetry reading?
Poetry, right? Yeah.
All right, let me pull it out.
In full disclosure, I'm an expressive arts therapist. So, yeah, so I'm really interested in any dramatic, poetic, artistic modality.
So if anybody was at the Listen Up concert that was held here last year, you've already heard this because I read it there. Masks. Imagine that everyone around you is wearing a mask. Everyone but you. You can't see from their faces anything but the murkiest expressions. Sometimes you perceive they are happy or scared, but how much? In relation to what? Mixed with which other feelings? Yet everyone else can read yours. To them, your face is not a mask. It's an open doorway, an inviting egress to your thoughts, your concerns, your desires. How does one cope? A common solution is to even the score. Sculpt your face into a wall of stone so they can read your thoughts no more. Does that answer your question?
That gave me chills, David. Thank you very much.
Pardon my voice. I would first like to thank each of you for sharing with us tonight. I would think that with a history of difficulty with interpersonal relationships and anxiety, what you're doing would be very difficult. But as a mother who only heard of NVLD 5 years ago, I very much appreciate your offering this education to the public. My son is 32 years old and has gone through all kinds of diagnoses through the years. And it was just 5 years ago that he was told that he probably either has Asperger's or a nonverbal learning disorder. And he and I have gone back and forth over the choice to own a diagnosis and use it as a way to find strategies, as opposed to a diagnosis having a stigma associated with it. And I know he shies away from the stigma, but has learned that he can grow by accepting the help of vocational rehabilitation people in finding work. So I'm wondering if you could speak to the stigma and ownership part of your experience.
Well, that's one of the reasons why not only I'm an open book about it, but that I wanted to do this is I want to help people who, whether they're on the spectrum or not on the spectrum, to learn about either both what it's like living with it and dealing with people who have autism. The stigma can be hard when it comes to I remember when me and David did a program at vocational rehab, which I highly suggest for anyone with any disability, whether it's autism or not. They do really, really great work helping people like us, getting jobs, learning, navigating social skills, etc. But me and David, that's how we met. We met at vocational rehab, where, sure.
So this was, it was a program at North Star. It was called, I'm forgetting the name of it now, on the tip of my tongue. So I didn't get into that through Voc Rehab. I'm not sure if you did, but yeah, that was a North Star program.
I know you're an intermediate. Okay, so
So the question was about what are the benefits of owning a diagnosis, and then what are the challenges or the stigma around the stigma of having the diagnosis?
So the benefits of having a diagnosis, well, for me it's kind of half and half. I don't like to use my disability as a crutch. I don't like to use it as, oh, well, I have autism, so I don't have to participate. I don't have to do this. I only use it if I really, only in that instance when I don't, I don't have to do this, only if I don't understand what I'm supposed to be doing and I'm just too afraid to ask. Some of the other benefits is hopefully when you get people that understand or are understanding, when you come and say, I have a learning disability, I need help with this, this, and this, they can either be really accommodating or they want nothing to do with you. It depends on how you take it personally. Some people, they find out they have a diagnosis and they curl up in a ball and they want nothing to do with life. Other people, like me, they try to see the positive sides and they try to help enlighten not only people who are on the spectrum, but people who aren't on the spectrum to learn about it and want to know about it. And the other, what was it, the stigma around?
Yeah, the stigma of the diagnosis and how that might be a challenge.
Usually it's a challenge for getting jobs. And like I meant to try to say earlier, when me and David were in this program, we had to do job applications. I hadn't had a job at the time. And so one of the things they made us do is, go to the mall and fill out applications, but they went around and asked us, would you, when you go into an interview, would you tell somebody, or is it appropriate to tell somebody that you have a learning disability? Me and the other girl were willing to let people know, versus David and the other boy that was there were the complete opposite. And I couldn't figure out why they were the opposite. I think it's good for people to know so that, if I do something that to a neurotypical is considered off, then they remember, oh, well, she has something that kind of affects it. It causes it, so to speak. Yeah.
Chris, David, do you have anything to add to that?
Yeah, I think it's important to own up to it, and just accepting who you are and what you are. That kind of like lifts a weight off your shoulders. I know that when Asperger's was explained to me, it was sort of like a moment of realization that everything that in my life had never made any sense instantly made sense. I don't know how to really explain that feeling, but you know, it was good. Like Kelly had said, like you absolutely cannot use it as a crutch, though. Like that's the worst thing you can do with it. You know, there's no point in gaining that sort of independence and then kind of stabbing yourself with it, because a crutch only weakens yourself. You sort of condition yourself into, because I know that I used my IEP in high school to really wiggle my way out of almost any kind of responsibility, not having to do anything. And after I left, I realized that was a horrible thing to do. It was a very cowardly thing. You know, I didn't feel really good about myself for a long time after that. But, you know, owning up to it is important, but not using it as a crutch is even more important.
So I kind of pulled a 180 a few years ago. I used to be really afraid to share my diagnoses with anybody. I feel like there's a lot of negative portrayals of ASD in the media, and there's a lot of misunderstanding, and there's a lot of people that really, they look down on it. They use it as an insult. And so I was really afraid to tell people about it for probably 13 years after I was diagnosed. The thing that turned it around for me was when I realized that I was able to be, and that I had been, a positive role model for younger people that I was working with who were going through the same challenges. And I decided that if I want to be able to do more of that, which is, it's kind of the whole reason that I went into this program, if I wanted to do that, then I had to be open about it. So yeah.
One of the hardest things about the stigma is kind of like what I said earlier, when people hear autism and they assume it's one thing instead of what autism spectrum is multiple spectrums. So the hardest thing is when you have people, and we all meet them, who are that kind of ignorant person who's like, oh, well, she's autistic, so she can't do anything. Or she's not as smart as me. The thing that someone on that spectrum needs to remember is, one, don't listen to them. But two, just try to stay positive and work through it.
Thank you. I think we have time for one or two more questions, if there are any. Yeah.
Hi, thank you for being here. I'm actually in the nursing program at UNE, coming from a background in special education and rec therapy. So what's new for me is that we often care for patients based on what's observed or measured, and you've all spoken to the idea of visibility with these diagnoses. So I'm wondering, from a healthcare perspective, what your experiences have been and what we as healthcare professionals maybe do well, but also what we could do better.
That's a difficult one.
So any specific challenges working with doctors or things that doctors have done that has been surprisingly helpful?
One of the things, I mean, I don't know if a neurologist is considered a doctor, aren't they? One of the things, physical therapists that helped me when I was younger, when I had trouble using my hands, they helped me be able to learn how to write so that I didn't, scribble all over the page. I think the hardest thing was when I was younger and they, because I couldn't explain what I was feeling, what I was going through to other people. And so like my parents would take me to get like the CAT scans where they would take pictures. And because I had anxiety and I didn't know what anxiety was at that point, and so I would be terrified when they put me in the machine, but I couldn't say that I'm afraid, when if I could tell myself now when I was younger, if I could tell my younger self, I would have just said, don't worry, everything's gonna be okay. I haven't really had that much hard time with doctors. It's more been people that didn't understand what I had, or they may not have been familiar with either nonverbal learning or any of the disorders. That's really the only.
I would say what's crucial in medicine when it comes to dealing with autistics is pediatricians. Mine was incompetent entirely when it came to mental health. That was one of the reasons I didn't get diagnosed, because his was, oh, he's shy, oh, it's a phase, oh, he's a boy. Just every conceivable excuse, because he just didn't know. So I would say that the pediatrician is key. I mean, I know pediatricians are kind of at the lowest rung of competency anyway. So I would think teaching them is, I'm sorry if I insulted anyone. That's, again, that's my autism. I'm just speaking from my experience. If that's insulting, oops. Or at least what I've understood with pediatricians, that they're the lowest trained, or that's the lowest of competency.
I misinterpreted his tone of voice. That's what it was. Sorry.
Okay. I'm sorry.
Is there anything that doctors have done that have been helpful?
I would say in my adult life, once they knew of my diagnosis, there was no problems. So I would say that once they know it's not a problem, I would say that their ability to see it when it's not known to them, and just be able to. So diagnosis would be good. So them saying there's something off here, and then suggest. Like if my pediatrician had been able to do that, like that would have saved me a lifetime of suffering. So I would say, if anything, you've got to target pediatricians and make sure that they're properly trained. I mean, once you get to primary care physicians when you're an adult, that's a different story. But I would say pediatricians are something that should be targeted. I mean, of course, I would think that nurses of any stripe should be cognizant of that as well, obviously. So, but I would say in terms of doctors, I would say pediatricians would probably be primary focus of future education efforts.
I would add, I feel like developmental disabilities and intellectual disabilities are something that there tends to not be a whole lot of training around in the medical world, which can make it hard for medical professionals to work with people on the autism spectrum. For me personally, I am a slow processor, so I think more slowly than the average person. And that's not something that's necessarily the case for people with ASD in general. I know people with ASD who are very fast processors. But I feel in a lot of cases, when I would see a physician, I would feel very rushed, and I wouldn't have enough time to like adapt to the new person and the new environment, and to really soak in what was explained to me, and have an opportunity to ask questions. I feel like in general, in the medical world, there's not enough time given to do just about anything. So I see that as like a structural problem. What's been helpful for me is working with people who do give more time and who have good relational skills and good communication skills. I think that in particular is a major boon for patients on the autism spectrum.
It also helps, whether it's a pediatrician or even a nurse or a doctor, to even if they know someone who's on the autism spectrum, or if they know anything about it, you know, if they see someone, a patient who may be acting, if they know anything about autism, then they may be able to help them versus someone who doesn't see those signs. They might not be able to help them as well. But kind of like what David was saying, I've heard of people talking about how, oh, well, I didn't get to spend enough time that I think I needed with the doctor. It was just like I felt like I was in and out, when for some things it should be a little longer. But I don't know, it depends on the person.
So I think we've hit time. Thank you so much. It's been so great.